The new healthcare system that is the law of the land is falling into place despite Republican threats to gut it. We've invited our good friend Andrew Rubin to tell us what has changed for millions of Americans as of January 1st. Andrew, there are things happening right now. You're hearing the squabbling in Washington, but for millions of people, these changes are falling into place. Tell me first about seniors and the donut hole. Anybody who's, maybe under 40 doesn't know what the donut hole is.
This is a big deal. So the donut hole is the portion of the drug costs that seniors have to pay on their own once their insurance has run out, essentially. And starting this year on January 1st, 50% of the cost for drugs once the seniors enter that donut hole is paid for by the government. So it essentially cuts the donut hole in half.
So it is a benefit that people are going to see immediately.
Instant savings for drugs.
But will Medicare premiums rise, do you think?
So Part D premiums, which are for drug costs, actually aren't really rising. The increase in premiums are for physician services, Part B. They're going up 4.4% for seniors who make over $85,000 a year as an individual or $170,000 a year as a family.
Let's also talk about some other free things for Medicare recipients. They're eligible for all kinds of free preventive care and examinations right now. Tell me about that.
That's right. This is a big deal, and this is a big change. An annual physical with no co-insurance and deductibles, where seniors can go in and get checked out once a year. They also get they have no co-payments and co-insurance amounts for mammograms, colonoscopies, blood pressure screenings, immunizations, things like that.
What other kind of changes can people across the board expect to be? We know that preventive care coverage applies to everyone.
It does, but not all employers or private insurance plans offer it with no co-pays and co-insurance amounts. But under health care reform, most of us who get our insurance through our employers will have no co-insurance for colonoscopies and mammograms and things like that. And in addition to that, children under age 26 that we've talked about a lot will be able to stay on their parents' policies. Children with pre-existing conditions won't be excluded from the healthcare system anymore. So big changes there.
Speaking of preventive